Hello Blazers, welcome to episode 38 of UAB Green and Told. Original air date Monday, February 1st, 2021. Through this podcast, we are able to share stories from members of the UAB community. I'm Greg Berry, Assistant Director in the UAB Office of Alumni Affairs. This week, we are joined by John Doriety, a member of UAB's much-traveled Critical Care Transport Service team. As part of a family that moved a lot when he was young, John will discuss why UAB felt like home.
For me, UAB is, and it goes without saying, profoundly multicultural, and was really kind of along what I was used to.
In contrast to his childhood, John has now set down roots, building a 20-year career with UAB's Critical Care Transport team.
I knew I'd be a part of it, and it's been a phenomenal career. Looking back, I don't know that, you never know what life's going to throw at you.
And as he'll share, John has done and seen just about everything, including a historic transport that took him under the cover of darkness.
Once we landed in Guantanamo Bay, we took an ambulance to the bay, and we got on a boat, and we traversed across Guantanamo Bay in the middle of the night, where we really weren't supposed to be, it seemed like.
An Army brat, John Doriety moved every 3 years and lived here and there. When John was just entering his teenage years, his dad retired and the family moved to Birmingham. That move led to scouting, and through it, a career in medicine.
Boy Scouts for me was a big turning point. I think when we got more established, more grew our roots here in Birmingham, I got involved in scouting, and it developed me greatly. And I always remember my first experience. I actually had a Eagle Scout opportunity that led me to shadow in UAB's cath lab here, and it was a phenomenal opportunity. They hooked me up with a profound professional, and I got into the cath lab and got to watch as a teenager one of the most amazing procedures ever, and that's probably when I got hooked. And my senior year in high school, I had a executive high school internship program, and this was like a co-op opportunity as a high school student. And of course, I was driving then. I was, that teen that we fear with our kids. But I was connected with Medical Center East at the time, now St. Vincent's East, and half my day was spent in the emergency department there. So it was a very eye-opening. I just observed. I wasn't allowed to do any direct patient care, but being, that young and, absorbing the influence of other coordinate professionals and stuff, that was a huge influence on me in pursuing medical.
So at that point, was nursing kind of the plan, or was it maybe going to be a physician, doctor, things like that?
I, through high school, I had a huge interest in going through the surgery assistant program, PA program, physician's assistant. At the time, UAB has that program here, and made some, probably wasn't the most profound student initially when I went, because I started college career at Jeff State and straight out of high school, and didn't even have a summer off at the time. So I probably, unfortunately, didn't apply myself the best in the first couple of semesters there then, but it just grew into a opportunity in seeing what nursing did back in high school. I was like, medical field's where I'm going to be at. I know that's the area, but I got I had an opportunity to apply for radiology tech program at Jeff State, and then that didn't work out. And after 2 years at Jeff State taking prerequisites, I transferred to UAB, and then that's when I'm going to pursue nursing. Understanding what they did, each specific area of nursing is so different, but collectively it's the same. Caring for people and helping them through the most difficult times of their life, and sometimes the happiest times of their life. And so I just kind of got attached to nursing.
You attended UAB back in the mid to late 90s. Obviously, it's dramatically different now than it was then. What are the noticeable changes that you've seen over that time period?
Definitely through the development and advent of technology, we're able to sit here and be in two different locations and talk through a computer. That wasn't quite the possibility as a beginning nursing student then for me. Classroom time was very important. People are different learners. My son, our kids, I think are a lot more technology driven, obviously. And for me to sit into a classroom, I learned better then. And I think that's the most profound difference between the generational nursing students now. For me, I'm seeing what they have available to them from a simulation standpoint is quite remarkable, very innovative, and it's helpful in development as an early nurse and nursing student to be able to be exposed to that without actually, initially putting your hands on somebody. But the simulation it's done across the whole healthcare spectrum, and physicians and radiology technicians and the different areas and fields and stuff. And so I think technology is the biggest driver in how we learn now. And so we're always in our phones all the time. So that's, I think, a big driving force in it.
What was your undergraduate time like when you were at UAB around 1995 when you first got here?
For me, it was adjusting from a junior college perspective, which was phenomenal and kind of laying the groundwork, minus the first couple semesters. But the atmosphere of camaraderie, for me, UAB is, and it goes without saying, profoundly multicultural, and it's being exposed to different cultures, different people was really kind of along what I was used to, being an Army brat, being in the military. My father being in the military, and so I enjoyed that. I enjoyed hearing different perspectives and different variable cultural norms, and seeing, some of my friends and things experience college with me, and that, I think, was one of the drivers in when I first got here. I felt comfortable.
You graduated in 1998 with a BSN from the School of Nursing, and you immediately went to work as an emergency and trauma nurse after graduation. Was that kind of where you wanted to be at that time?
The draw for me, I was exposed to the trauma atmosphere when I was an emergency medical technician, and I got that certificate through UAB as I was a student at Jeff State. Being able to get into the EMS system and getting exposed to the pre-hospital care was really important. I enjoyed that aspect of patient care. As I had mentioned with the Executive High School Internship Program, I spent my entire senior year in high school in an emergency department. So that was kind of the specialty that I was leaning to. And EMS and pre-hospital EMS was fun. It was interesting. It was motivating. I was the volunteer fireman for a while with Centerpoint Fire Department, and seeing the fire service side of that, those are profound professionals that do a very difficult job, and we certainly see them and appreciate them, and I wanted to be a part of that aspect of medicine.
Roughly 20 years ago, you actually joined the Critical Care Transport Service at UAB. What was in the decision of making the transition to be part of this CCT?
So as I had mentioned, I was EMT basic. One of the jobs I had, we had the contract for UAB's Critical Care Transport Team. I carried a pager and basically drove the ambulances as a EMT, and traveled much of the state of Alabama within 150 miles with this bigger than life specialized medical transport system known as UAB Critical Care Transport. Got to know our director, Laura Lee Dimmons, and from there she remembered me after I'd gotten my nursing experience, and offered me a part-time job with CCT. Made that decision to move to UAB nursing-wise, and started working in the emergency department and part-timed with Critical Care Transport. And then once a position opened, I eventually came on full-time.
Did you ever think that you would make a career at CCT and 20 years, 2 decades worth of experiences?
I knew I'd be a part of it, and it's been a phenomenal career. Looking back, I don't know that, you never know what life's going to throw at you. We did. My wife and I moved away after I came to UAB for a couple of years, moved to Jacksonville, Florida, and worked at the trauma center down there. Stayed down there for a year, and much like the whole adage of Hotel California, we moved back to UAB because this was home. This is what was familiar to us, and the opportunities that is available to people here at UAB, both as a patient and both as an employee, was profound, and it just was home. We bleed green and gold at our house.
I know it might be a stretch, but do you remember that first transport that you did with the CCT?
Vaguely, vaguely. My first transport was in 2001. I do remember, and I believe it was a ground transport. It was through orientation, orienting to the job. One of the big things is having experience coming into this job is really important. Having that critical care knowledge, the ability to think critically, collect the information and figure out what's going on was important. So the orientation process for me was thinking outside the box, was learning what to do in the event of traffic. We have lights and sirens, but we try not to use that if we can. And it was kind of a learning curve, learning that for me in a way. We're bringing UAB medicine to outside facilities, and once we go in and we have consent signed, they're essentially admitted to UAB at that point, no matter where we're at. And so that was, I remember it was a ground transport, and and it was a pretty sick patient, but I have a lot of admiration to the folks that oriented me at that time during those first few trips coming in.
Talk a little bit about exactly what the CCT does, because this is not just a service for Alabama. I mean, this is a service, you service all 50 states, countries. I mean, you go transport people from all around the world.
UAB has a lot to offer, both as a community, UAB Medicine, both as a community and as a regional leader in medicine. And we go out and service the region for the most part, but we bring UAB Medicine to the people there in their facilities. There's a huge spectrum of healthcare out there that is different. And there are facilities that are very rural, have limited access to advanced healthcare needs, and some hospitals may not have a ventilator. They may depend on their EMS to help them mitigate patients to higher levels of care. And what we bring is that higher level of care. We're a nurse, respiratory therapist, and one of the very few transport programs that's able to bring a physician as well. So we truly bring UAB medicine. We've been involved some with telemedicine, and that's a huge thing currently here at UAB, especially during this pandemic. And being a part of that is bringing those innovations and the latest medicine to people that otherwise wouldn't have access to that in their areas.
Is there a most memorable transport that you have done over the 20-year career that you've had with CCT?
There has. My biggest, I think, coup de grace was our Guantanamo Bay, Cuba trip. Yeah, everywhere I go, I've talked about it. It was very profound to me in that this was a situation in which was a mass casualty disaster, Haiti earthquake, and we were asked to medevac a patient out of Guantanamo Bay, Cuba, back to the U.S. And the biggest thing with this was that the Cuban government was in discussion with creating a medevac route to be used, and in these certain circumstances, and it hasn't been used ever until we went down there. They were expecting, quite a few mass casualty patients to be medevaced out of Haiti. Guantanamo Bay was a staging ground, especially for U.S. citizens and military alike there and patients. We were the first in as far as doing a medical transport of a patient out, and we flight planned to actually traverse over Cuba, the country of Cuba, and that was the first time that a U.S. aircraft civilian aircraft has done that since the embargo, since the 60s. So we essentially at that time laid the groundwork for other medevac programs and systems to come in through and medevac patients out of Cuba at that time. So that's most memorable. Once we landed in Guantanamo Bay, we took an ambulance to the bay, and we got on a boat, basically the equivalent to a Boston center console, Swiftwater Boston whaler, and we traversed across Guantanamo Bay in the middle of the night. So it was kind of awe-inspiring for me to, be on a boat with Dr. Barlotta and Regina Baragwell at the time, and these two Navy professionals, and going across this bay in the middle of the night where we really weren't supposed to be, it seemed like. So, and it was quite an exciting time.
That was obviously an air transport with critical care transport unit for UAB. What's the breakdown, though, between land and air transports?
So, excellent question. We usually do about 1/3 of the transports we do are air, and the rest are ground. So anything under 150 miles will drive. Anything over will fly, typically. The furthest north reach is about Huntsville by ground, and furthest south reach is Montgomery. So anything within that confine of 150 miles will drive it. And jets are utilized outside of 150 miles, unlike helicopters. Helicopters are better utilized within 150 miles. UAB doesn't currently have a helicopter. We've always had a fixed-wing jet. There is that difference in time, how quick it takes to get back to UAB, kind of thing, and it's always, it can be a challenge sometimes. But when we get when we get employees in and we get new hires in, and that's the big, I think, specialty, that being a transport professional, a critical care transport professional, whether it be a medic or a nurse or a respiratory therapist or transport physician, is being able to think outside the box in those circumstances, because there's different imponderables that you run across that can placate, delay, and cause issues for you. We're not here to teach you how to be a nurse or an RT. We're here to teach you how to transport people. So,
how has the process changed, or how has the service changed over the 20 years that you've been doing it?
So the mode of transport's not changed in quite a while. It's always been helicopter, jet, and ground ambulances. Our accrediting body, CAMES, accreditates all modes of transport. The biggest change for us, I think, is innovation. Innovation with medical equipment. So innovation is a huge thing in transport medicine. We have the ability to do nitric transports, specialized gas, and in facilitating oxygenation and helping patients. Just making technology smaller, more adapt has been the biggest innovation for transport medicine, for sure. Until we get spaceships and rocket ships, then teleporting, that's not going to change, I think. But for the most part, it's been the innovation of what we were able to bring to our patients out in the community.
Knowing that every day is probably different, what is the typical day for you at work?
So we run 12 or 24-hour shifts here. The full-time team members, and we have a large contingency of very experienced part-time transport folks that work with us. But we come in, we have our office duties that we do. It may be tabulating and communicating numbers, and what we do is, as far as innovations and reporting those, and doing quarterly QI stuff. So we all have our own duties, equipment checkoffs, going through our medicines, checking expiration dates, making sure all of our equipment's up to par, and training. Definitely, we love education and training. So we do that until we get dispatched, until we get paged for transport, and we will never know where we're going to be. We could spend all day of the 12 hours or 24 hours here in the city and not move a leg outside the city. And then some days, like I said, we can be in 3 different states. We can be, flying out to Texas and then Tennessee and wherever else. So Florida Panhandle is a big referral area for us. Mobile is a big referral area for us. And then a lot of, the ground transports, we could be in Gadsden, Anniston, anywhere, Montgomery, Huntsville. So we never know where we're going to be. We're not guaranteed to get off on time, but that's something that we, come to expect, clocking in and coming and doing our job, and it's a privilege to be able to do it.
With over 3,000 transports, that's about 150 a year for you throughout your 20-year career. Have you ever sat back and counted how many states, countries, miles you've actually done with the critical care transfer unit?
I haven't, and I need to, because I'm nearing the end. I'm about 7 years out, I think, or pretty close to retirement. So I think being growing up through this department has been a gift, and it's not one to be taken lightly. And definitely doing, I'm sure down the road I'll be doing some deeper inflection and reflection of my experiences here. I approach it that by each patient. My next patient I go get, I approach it as I've never done this before. This is my first time meeting this person, and this is my first time bringing UAB medicine to this person. So each time is a new experience. Nothing's ever to be taken for granted. And I think looking back on this is I'll collectively grab how many millions of flight miles our department has done. How much of that have I contributed to it? But for me, it's not about me. It's about our patients and how we bring UAB medicine to them and to further them along in their story and in their lives.
With your transports, you probably see a myriad of different diagnoses and things like that. What are the range of things that you do see when you're transporting these individuals?
So UAB provides adult transports and neonatal critical care transports. We have a neonatal team that's led by our neonatal nurse practitioners. They're highly specialized in providing our level 3, level 4 regional R&I ICU here. But for me as an adult CCT employee, we see a range of patients from traumas to cardiac and pulmonary issues are probably our number one. Sepsis. We have basically all areas except for what we don't transport is women in active labor and extreme morbidly obese patients. Uppers of 400 pounds or so is kind of what we don't see. But anything under than that, then we do transport. So basically a jack of all trades and master of none's like what a lot say, but we have a lot of masters of a lot of things. So we have a lot of our part-time employees and a lot of our full-time employees. We have some that are from our neuro ICUs, from our heart and transplant lung ICUs, and they all have their own subspecialties. My big thing was ER trauma that I came from. So, but we learn how to take care of the other patients and expand our scope of practice and understanding, getting outside of your comfort zone a little bit.
You talked about the staff, the full-time, the part-time. How big is the operation? Because you just said 3 ambulances. Obviously, you have the air support as well. So what are we talking about?
So you have the three ground critical care ambulances. We have a vendor that provides additional ambulances should our teams need it. We've had the one jet that's UAB's jet. If you look up underneath it as it's flying over, it'll say UAB on the bottom of it. We have 4 to 5 full-time team members and then 15 or so part-time adult RNs. We have 4 or 5 full-time respiratory therapists and a whole contingency of part-time folks there. And then our neonatal side, like I said, we have our nurse practitioners, a good handful of full-time nurse practitioners there, and then some part-time as well. So small department, but a high budget because those engines aren't cheap on the jet, and everything's break down.
That's John Doriety. John graduated from the School of Nursing with a BSN in 1998 and also got an emergency medical technician certificate from the School of Health Professions in 1994. With more than 3,000 transports in his 20-year career, John has become a remarkable ambassador for UAB and has a great idea of what it means to be a Blazer.
To me, it's a conglomeration of community, adopted family, big heart that bleeds grand gold through and through. It's innovation. It's pursuing the desire to improve ourselves and our community, an ability to be able to improve our families. It's your heart and soul. It's probably one of the most important things I've ever done was to come into the UAB family and be accepted into it. It's been a remarkable career, and I think it's something that our students, faculty, alumni shouldn't take lightly. And once you get here, you probably don't. It's it's a part of your heart and soul.
Be among the first to find out when new episodes of the podcast are released. Subscribe on Spotify and iTunes, or listen in at alumni.uab.edu/greenandtold. Know someone who would make a good guest? Email me at greenandtold@uab.edu. Also, be sure to follow us on Facebook, Instagram, and Twitter. Just search for @UAB Alumni. Thanks for listening, and until next time, go Blazers.